completed his MBBS from University of Malaya in 1995. Then he was in HKL, where he continued his specialty training as a member of Royal College of Physicians in UK in 1999, and he also spent some time in Westmead, Sydney, which helped him gather a lot of understanding of various pediatric diseases. And Dr. Azam is also a member of a lot of Pediatric and Interdisciplinary Association and regularly attends a meeting. And he's going to talk about the one chicken that you don't want to have in your house. Azam, the floor is yours.
Thanks, thank you very much. There will be a lot of overlap between this topic and the one that was done by the previous speaker. Generally, we're talking about chicken pox. One of the most exciting questions that I had whenever I give a talk about chicken pox to the public at one point of time, which I couldn't actually answer, was one of the parents asked me, why is it chicken pox, not duck pox? It was quite difficult to answer that. Alright. Okay. Generally when we talk, these are the topics I'll be covering. It's about parasite disease, chicken pox, the burden of chicken pox. I think we'll address the one question you asked. Now, the benefits of vaccination to prevent chicken pox, I think that will be answered by the previous speaker. The varicella vaccine in Malaysia, the types of varicella vaccine in Malaysia, and now we are talking about the new vaccine that we are bringing in called the Sky varicella. Okay, as everybody knows, chicken pox due to this virus called varicella zoster virus. It is the herpes simplex virus type 3, and it causes two main important diseases, which is varicella chicken pox or varicella infection, or in the later on in life, the activation of its latent form, which is called herpes zoster. Yeah? So it is a DNA vaccine, a virus, and therefore it is something that you do see frequently in childhood. Yeah? Well, it's an acute infectious disease. It is being carried by this DNA virus, and primary infection with zoster causes varicella infection, and like I mentioned just now, a reactivation of the latent form will cause herpes zoster. Yeah? Manifestation is pretty much classic. Usually you have fever, and then you get these small little dots over your body. They are vesicle in nature, means that there is water in it, and it's very abrupt, because in every part of the body, and then itches, blisters, and becomes dry. Yeah? Very different from hand, foot, and mouth disease. If you notice, hand, foot, and mouth disease is quite confined to a certain area in the mouth, in the elbow region, in the knee region, the buttock, and then on the hand and feet. Yeah? So it can be quite difficult to actually differentiate this hand, foot, and mouth disease and varicella infection. Yeah? So it's something that it may give a bit of a diagnostic dilemma at point of time, especially so in a very atypical presentation of varicella infection. Okay? More so if the children have been vaccinated, and when they present with this disease, it varies. It can be small little dots here and there, not much symptoms, and they just get better in time. Yeah? So it has got quite a bad complication. I mean, it's not easy to actually get chicken pox. I mean, have you ever had chicken pox before? It's terrible. I mean, it's not a nice disease to have. You have blisters on your face. It can get very bad. It can get infected. You can get cellulitis with it. There's also a tendency for it to become pneumonia, which can be quite difficult. Obviously, it can also cause encephalitis, which is very bad, you know. And then you can hemorrhage into it, and worst case scenario, you can go into sepsis. So, I mean, at the end of the day, to be honest, I find that it is an important disease for you to vaccinate. I mean, I wouldn't want any of my patients to get chicken pox, and each time when I speak to a parent, when they say, is it required? I say, well, it's not part of the National Immunization Program, but it's one disease that you don't want your child to have. So therefore, I tend to be quite, adamant with my chickenpox vaccine. But again, if you look at the disease incidence, because in 1.85 per 100,000 population, interestingly, you see that it happens more in the adolescent in Malaysia, adolescent and adults. Interesting. I'm not too sure why that's so, but this is something that I need to sort of highlight. Yeah? Infection is more severe in adults, like any other childhood illnesses. to be honest. If you have a childhood illness happening to an adult, I would always tell the parent it means that you're still young at heart because you still get childhood illness, but the disease can be very bad. If one were to get hand-foot mouth disease at a very during adulthood, it can be very debilitating because you got all this vision, it's painful, and obviously maternal infection can be quite bad. I mean, this is very difficult to treat. You need to give immunoglobulins in this group of children, which is not easy to get, to be honest. It can be quite daunting, trying to get it, and it's extremely expensive if you were to treat it in a private practice. 20 to 50% of mortality in neonates without parasite antibody may be due to severe pulmonary disease. So, yeah. But what I want to pick up is that this presentation of during later adulthood or adolescence, which I think can be quite important to look to whenever the vaccination is sporadic. This is what happens, I feel, because the vaccination of a child is not everybody gets vaccinated now. So you have a group of children that are being protected. Just say, if I'm born in a very urban setup, I am a bangsa boy, so to say. So I've been brought up with, most of my friends are all being vaccinated. One day I decide to go to another place where, it's more rural, where 90% of the children are not being vaccinated. There's a high likelihood that this boy, upon adolescent or when they go into colleges, they will be infected by chickenpox. And this is something that's important, you see, that needs to be addressed too, because we are now sort of changing the whole, the epidemiology of the disease. It's no longer a childhood illness, and it's now becoming an adolescent illness or an adult illness, which can be very difficult. Yeah? So with this, I tend to feel that at one point of time, we should be pushing towards varicella vaccine to be given in the National Immunization Program. Okay, this is a very interesting thing. I mean, thanks to this Dr. Takahashi, they come up with this Oka strain. It's a very famous strain, okay? Oka strain. Actually, what is Oka strain? It's actually a strain of varicella, this virus that was being isolated from a kid in this region called Oka in Japan. And what they do is that they culture it, reculture it to the extent that it becomes less aggressive, or meaning that it's a weakened virus. And this is what we call live attenuated vaccine. And it's important for you to understand when it comes to vaccination, there are toxoid or they are not live attenuated vaccine like your for example, your hexacin or whatever other vaccine that you get. And there's also the live attenuated vaccine. And you need to be a bit careful when you deal with the live attenuated vaccine, because there's a slightly higher likelihood that this vaccine can cause an illness in a child, more so if this child is immunocompromised. So this is something that you need to be careful. The MMR is a live attenuated vaccine, chickenpox is a live attenuated vaccine, Japanese yellow fever, for example, is a live attenuated vaccine. So these are things that you need to be a bit careful. So all the vaccination for chickenpox comes from this Oka strain, they call it. So whatever it is, can it be very wax, can it be very leaks, or even the one that we have now, Sky varicella, they all come from the same strain of virus, of live attenuated vaccine. Okay? So this is what it means by it. It becomes weakened so that it doesn't cause disease in general, but in an immunocompromised situation or whatever situation, sometimes it may be able to produce a mild form of the illness. Yeah? So you do see children at times developing a bit of lesions after a vaccination, but it's not very common. You do see at times children having a bit of rash after MMR vaccination, which is again not very common, but it's possible. And because it is all being sort of cultured in egg yolk, see? So you need to be careful when you give this vaccine to children with severe egg allergy, so to say. So you need to be careful. So what I tend to do, it doesn't mean that it's contraindicated. You can still give it, you must give it if you want, but you would ask the parents to just hang in around the hospital for the next half an hour or so if the child has got egg allergy. So again, this is another chart to say that there are some countries that are giving 2-dose vaccination. There are some countries that give 1-dose vaccination. Honestly, if I were to be given a chance to look into what kind of vaccine that I would give, I would essentially look into a one-dose vaccination. Why? It's simple. If you look at a vaccination schedule, it's tremendous. You see, you have your 2, 4, 6, 12. You've got MMR, which is now given twice, 9 and 12. You've got your pneumococcal, which is given 3 doses. Your influenza vaccine, which is given almost every year. And then they are now talking about the meningococcal vaccine, the hepatitis A vaccine. Phew, it is really, really stressful. And to think about it, sometimes I wonder at times, why do they come to the private practice to get this vaccine? Just imagine the cost that's involved. For a pneumococcal vaccine, it's 300 ringgit per dose, and that's 3 doses. For example, HPV vaccine, oh goodness, you don't really understand the reason why, but then again, well, I mean, I can't question them so much, is it because it's my pocket money? So this is something that you always question, why do they ever come to you for vaccination? So, I mean, again, it's obvious, anything that to do with vaccination, it reduces the severity of the illness. I mean, you don't have to, with everything, like for example, COVID, for example, how many of us has actually had COVID after the vaccination? I think quite a number of us. But was it bad? No, it's not bad. So one must understand, or a parent must understand, vaccine doesn't equate to 100% protection. Vaccine equates to a situation where you're protected, and if you were to get this infection, you get it milder, you don't get severity with it. And also, for example, tuberculosis or BCG vaccination. People question, oh, how effective is BCG? Well, I mean, is it effective? There are studies to show that it's also effective. But what is important with BCG is that it prevents complication from tuberculosis. So it reduces the incidence of TB meningitis. It reduces the incidence of TB osteomyelitis. So this is the importance of vaccination. And I think it's important for us to convey this message to the parent, to make them understand that it is not 100% protection, it is to protect your child, and if you were to be exposed towards it, you will get a milder disease. I think this is important, and I think there's a lot of issues, especially with regards to COVID vaccine, that people that now tends to talk about, but they do not address the whole situation. Alright, yes, like I mentioned to you, a breakthrough infection means, there's a definition, it means the infection that occurs 42 days after varicella vaccination. Varicella vaccine confers 80 to 85% effective in preventing this disease and 95% in preventing severe illnesses. The problem with when you have this child that has been vaccinated is the manifestation of the illness differs. It becomes different. You don't really know what you're looking at, and at times you feel stupid not knowing what you're dealing with. But at the end of the day, you can understand that this disease doesn't need to be treated anymore. Chances are it will get better, and it will not cause any problem to the child. So this is the beauty of giving the vaccination to a child. Alright, so in general, prevention is better than cure. So it's been there since 1997. It has reported more than 95% effective in preventing moderate to severe forms of infection. So let's talk about, I think this has been mentioned. I mean, obviously during MCO, the vaccination drops. Even patient coming to the hospital or clinic drops. They don't want to come to the hospital because they're so worried and frightened of getting the disease in the hospital. So, as you know right now, we have two important major players in our country. One is called Varivax, which is a MSD vaccine, and Verilix. Both are varicella vaccine, and both advocates 2 dosing, 1 dose and another one 3 months later, or even a few years later, if you were to give the combined vaccine during the initial primary dosing. Yeah? So we are talking about new vaccine called Sky Varicella. So this is a product by Bioscience. Yeah? It's a Korean product. Again, it's given subcutaneously. What is different about it is that if you look at this, it has a higher amount of varicella zoster virus in it. It's got more than 2,400 PFU, which is different compared to the Varivax and the Verilix. I think it's around 1,300. So you're dealing with a higher concentration of weakened varicella virus. Yeah? So therefore, we would expect that immunity that it confers will be much more higher than compared to the other two. Yeah? And therefore, that's the reason why perhaps this vaccine is being mentioned as a single dose vaccine. So this is the different thing about this compared to the other two vaccine, whereby over here the claim is that it is given as a single dosing vaccine. Right, it is indicated for children 12 months to 12 years. And like any other vaccine, it is given subcutaneously, and it is approved in all these countries, such Korea, Thailand, Pakistan, Chile, Malaysia now. Yeah? So let's go through this study. I'll just go through this simple, frame of study. This is a phase 3 clinical trial where around 488 participants are being involved, and you do the non-inferiority study whereby they do both things. One is called using Sky varicella, and the other one uses Varivax. And they look at interval period to look at their adverse effects and also the immunological effects that it has. Yeah? So what they do, they measure the antibodies, and they measure it through the ELISA, or the mechanism enzyme-linked immunoabsorbent assays, or the fluorescent antibody to membrane antigen assay. These are the ways that actually look at the effectiveness of the vaccine. And it is mentioned that if the titer is more than 1 to 4, it is the chance of a child developing the disease is less than 3%. If the titer is less, the chances of having the disease is higher. And on top of that, they conducted what we call a non-inferiority phase 3 study against Varivax. So they wanted to sort of convince us that this vaccine is as good as the traditional, or what we tend to use for many years, the Varivax vaccine or the Varivax vaccine. So it's quite a very, it's a busy slide, but I'm never that good with it. But generally what it looks at is that it looks at the baseline level of the Sky varicella and how much it produces antibodies, and it was significantly compared to the control group. And if you to compare to the Sky Varivax group, it is almost similar. Yeah? And then they look at it at 6 weeks, and this studies is also similar. In actual fact, what you do see is that you do see a higher amount of seroconversion or antibodies, in the Sky varicella vaccination group. Reason behind it is pretty much simple. You are giving a higher amount of vaccine, weakened vaccine load. Therefore, there's a higher immune response to this vaccine. Yeah? And similarly, they look at the week 6, and they look at the seroconversion status of this vaccine, and they have without just looking at the numbers, you know that the seroconversion rate is pretty much very good. To be honest, it's around 99.53 in the Sky varicella group, 96.38, and there is a higher seroconversion rate in the Sky varicella group compared to the Varivax group. Yeah? Well, they look at these geometric mean titer, meaning that how much antibodies are being produced. There's a complex mechanism of using, compiling it and doing a log thingy, which is far too clever for me. But what it tells you is that, again, the value in the GMT value in the Sky varicella group is much more higher compared to the Varivax, and definitely more compared to the control group, which do not get anything at all. So there is no question about how good the immune response of this vaccination is from the vaccine. Again, it is a study to look at seroconversion rate by another mechanism, which is the ELISA mechanism, and again it shows that the Sky varicella vaccination seroconversion is much more superior compared to the Varivax group. And remember, this study is a multi-center study. It was being done in Korea, Philippines, and Mexico. The numbers may be quite small, I must say, but all these countries showed similar results. Yeah? A very good seroconversion, slightly higher seroconversion rate in the Varivax varicella Sky varicella compared to the Varivax except in Mexico. And there is also this thing called the non-inferiority margin, which is being created to show that whether is Sky varicella vaccine inferior compared to the Varivax. Obviously, it did not show any form of inferiority, meaning that in fact it shows that it was slightly more superior compared to the Varivax vaccine. Well, I mean, they look into the safety profile of this group of vaccination. They look at what we call adverse events. They look at the adverse drug reaction, and they also have a bit of a severe adverse events. So generally, the adverse events on both vaccination were almost similar. There was no statistical difference between the adverse events that you see in Sky varicella group compared to the one that we look at the Varivax group. There was one severe adverse event that was related to the Sky varicella group, but when you look into it, when you did the study, it was non-related to the vaccination. So it was a documented event which at the end of the day was shown to be non-related to the vaccination. And they also look into presence of varicella like rash after the vaccination. Somehow rather there was more cases of similar varicella like rash in the Sky varicella group in comparison to the Varivax group. But if you again, when they look into the detail of the studies, there were some of it are non-related to the vaccination, and therefore when they did a comparatively study based on a larger scale of this Varivax, they found out that there was not much difference between this varicella rash incidents in the Varivax compared to the Sky varicella. In fact, the incident was in Varivax was approximately 3.8%, and the incidence in the Varivax, the Sky varicella was around 3.2%. So there's not much significant difference between these two groups of vaccination. So at the end of the day, what are the study outcomes? It says that it achieved a good seroconversion of approximately 99.53 with a confidence interval of around 95% of 97 to 99%. It satisfies the consistency evaluation criteria of all three countries, about 2 times higher than the control group, meaning that the Pharmaniaga titer of the immunity titer is 2 times higher than the control group. The seroconversion rate was very good, which is around 99.53 compared to 88.7 in the Varivax group, and this was statistically significant, and there was no statistical significance between the adverse reaction. So in total, in general, what they have shown is that the Sky varicella group has got higher seroconversion, has got higher immunity, antibody production compared to the Varivax group. But bear in mind, this is a very short, small study. It only involves around 488 patients, and will be done in 3 separate areas. So it is still something that is ongoing, and the phase 4 studies is ongoing. So this is the true fact about this vaccination. Yeah? So what is the take-home message? Sky varicella is a chickenpox vaccine for children 1 to 12 years old. It is a WHO pre-qualified vaccine. It has got no inferior, it's not inferior to whatever vaccine that we have currently. It provides affordable protection against chickenpox. 1 shot, that is something that's different from what is from the previous other 2 vaccines, where they advocate 2 dosing at a 3-month interval. For this, they only indicate 1 vaccination. But true enough, the study is still new, and there's not much of, they still need a lot of surveillance on this claim that they have, so to say. Yeah?
Thank you, Dr. Azam, for an excellent lecture on vaccine. Any questions from the floor? Dr. Azam, I can answer the reason why they call it chickenpox. I might be wrong, only by English. Because if you learn, if other language is different. In Tamil, it's called different actually. But CDC says apparently the blister that comes out, it looks like chickpea. That's one of the main reasons why they call it chicken pox actually. That's one, I mean, just to...
Not that common.
Of course, if you look at those days when we were medical students and we were house officers, whenever we attend the pediatric rotation, those who have not got chickenpox naturally will get it, and will get it worse actually. But now, seeing now, I don't see any of my house officers getting. Perhaps they have already got the vaccine since 1997 or something. And of course, we see those children who are malnourished. I have a fair share of managing hemorrhagic chickenpox, those post-transplant. Because in Malaysia, whenever chickenpox, if you go to the emergency department, they wouldn't admit you. If they say go back home, and right, or some of them will give the oral treatment. But often I tell, if they have history of transplant, then they must be admitted, even they have exposure to chickenpox. That's what happened. One of the patients post-transplant came in quite bad hemorrhagic chickenpox, and there was one who was a malnourished child actually. It's something that immunocompromised and neonates. Answering your question about son, we have advocated for our nurses who are managing especially neonates and children to be vaccinated. I was told the ministry has done some parts actually. Yeah. In fact, that was my request to the, in my paper, that at least the nurses who are managing children should get free you know, in ministry we do give influenza vaccine to our healthcare workers. There's something way forward actually. Thank you. Any other questions to Dr. Azam? Yeah. Yeah.
President, you strictly pointed out that it look like chickpeas, but normally we see a chicken when they peg on the skin.
Yeah.
That looks like.
That's another version that someone has advocated that actually. Yeah.
You see, like Azam started with duck pox. Duck won't get pox because they don't have the herpes virus. Unlike other animals like elephant pox, even chicken has got chicken pox, pigeon pox, monkey pox. All these are the herpes virus. Now, my question is, this is going to be very controversial with what the first speaker said. Just now the president said a little bit, I'd like to expand a bit more. In the Hindu religion, we consider chicken pox as Amma. In the Tamil, now this is a multiracial country. We use different languages to students. This is Amma. When you have the Amma, there's a lot of precautions the Hindus does. Keeping away visitors, their cleanliness, the type of diet they should have, etc., etc. Maybe the president is much a better Tamil than me to explain. And you see, one has to get chicken pox in his lifetime. I have acquired chicken pox after I finished my Form 5. I was about to take a ship to go to India to study. After that I went. So we consider this as a very holy, I know how to put it, please bear in mind if I'm too, bothering you. Very holy, precious, etc. and it will subside evenly well. And we use a lot of other methods of cleansing, like turmeric, using turmeric, putting it in the hot sun, getting it sterilized by the ultraviolet waves, etc., etc. Using this, what leaf? Neem leaf, I call in Malay, in English it's called neem leaf, the other one is called bamboo. They use all these things very itchy. Can you describe more on this? Because this is where the Hindus will never get vaccinated against chickenpox. Even with my grandchildren, my mistake, I will never do it. So this is where this whole vaccination symposium must be at least a half a day, where we can really pick up the truth. And some of us are educated. Even if we are educated, we cannot put it back to the public in an easier language to understand. So we have this problem with the Hindu community. Likewise, the other vaccines, we have the problem also in various ethnical groups particularly also in Sabah and Sarawak. Never forget, whenever we talk about Malaysia, we only know the Semenanjung. We always forget East Malaysia. We go to East Malaysia, it's very worse. Can the president, somebody trying to highlight this in terms of what I've asked you, and I've also mentioned, I treated elephant pox in an elephant. I acquired monkeypox after doing a postmortem on orangutan. Okay, and what do you call? If you look at all the pigeons flying freely, 80% of them got pigeon pox, but they are not transmissible to the humans. Anyway, I don't take much of the time.
For those, Dr. Valian was formerly, he's a very senior veterinarian, formerly in our National Zoo, and he has served many areas actually. Comes to my game. I don't know, I mean, I got my chicken pox when I was in primary 1. Of course, what he said is secondary prevention actually to fumigate the scars from the chicken pox. I mean, it's just, we tend to be vegetarian, and we tie the neem leaves at the entrance of the house to say that you don't go into the place because there's someone with chicken pox. And I think 7 days you have to lie on a mat. It's made of neem leaves, turmeric, bath, and everything. Of course, you don't get. I didn't get any of the scars actually. But I advocate my relatives and my nephew and nieces and grandchildren that you have the chicken pox actually. That is part of the culture that those days they didn't have a vaccination, and it was thought to be special thing to our deity. But now we do practice giving vaccination. I think I would advocate to everyone to vaccinate if you have the means, and hopefully the cost comes down. And it's in the NIP. I'm sure I will be advocating to everyone to get chickenpox vaccines, because as Dr. Azam pointed out, if you get vaccine, you ameliorate the disease, and if you don't get, and you get it worse actually, especially if you are in adulthood. As you said, you got it when you went to India. My younger brother got it when he was sitting for his Form 6 exams. Can you imagine actually? So it's really difficult, and that's the time when you really get it and you're exposed to it. So, I mean, my conclusion as a pediatrician, I will advocate everyone to get the chickenpox. And if you look at it in India, they are advocating. In India, the chickenpox is in part of the national program. In India, the states are different. I did some research. Every state, I'm sure Ajit will tell that, every state has different. Like in Tamil Nadu, they give, even part of the district, they have different. Same like in Malaysia, we give Japanese encephalitis only to Sarawak. Similarly, certain districts they give. So I think the general population, we would advocate, of course there's always religious belief into everything, but as we say, they must be confident, they must be convenient, and not complacent, advocate vaccine.
So I'm just wanted to point out something in regards to the KKM vaccination. The thing is, what I feel is that true enough, the government may not be able to cater to all sort of vaccination, but I always feel that the information should be given to the patient. You see, one thing's interesting about the private practice setup is that whatever vaccination that's written onto the book, generally for those who are very much into vaccination, they will come religiously to get it done. See? So, but when in the government practice, before, for example, before pneumococcal was being adapted into the national policy, this was not being mentioned. See? So the parents do not understand the importance of this vaccination, and I feel that it's also, I mean, we can't be upfront with them. We say that these vaccinations are available, it's good to get it, but the government do not provide it because of the importance level is not so strong or whatever. But the information must be assimilated to them.
But I stand corrected. I mean, for my part, and as I'm an MPA member for a long time, as you know, even in my practice in Pantai and back in Selayang, I always advocate any of my patients who come in, be it my clinic patients or when I do my general rounds, I always tell them these are the vaccines available. Some are not available in the our national immunization program. But if you have the means, please get it actually. You can, I mean, even though, as you said rightfully, the pneumococcal vaccine was 230 or 300 ringgit, I tell them if you can get it done, you get it done actually. So I always tell my medical officer similarly, we are not giving it because of the priority the government has, but if the general public can afford it, please go and give it. So I often tell them to see my colleagues in private practice and get it done with.
It's not written in the books.
Okay, fine. Note taken.
I not in the books, yeah.
Yeah.
The latest KKM book, they have a variety. So there is a slot down there, they put other vaccines.
Yeah.
At least now they put
Other vaccines, at least something.
Right now, we tend to say that actually other vaccines available in Malaysia that have been WHO approved and licensed by our Malaysian, that we tend to put now. It's been an interesting point. I will bring it to the KKM.
Cold chain process the vaccine produced from say Pharmaniaga or company, come back, it goes to the host. I have seen there is a
Well, I mean,
It's beyond our, I mean, we can answer for anyone.
well, I mean, I guess at the end of the day, it boils down to the individual practice because there are many different individual practices. For example, in Pantai, where I work, it is something that is being audited all the time. Maybe because you are an MSQH accredited hospital or JCI accredited hospital, all these things are really looked into. So, I mean, it is not something that is a concern in our setup, but I'm not sure when it comes to individual setup where they actually store this vaccine in the fridge, and therefore, you know, it could be, the cold chain may not be there.
But for KKM side, I guess our pharmacies are always like hawks.
Yes.
They go around and looking for it. And I was involved in one dengue vaccine study, even though it was just that particular. And we are very, I mean, my pharmacist is very, very particular on the cold chain bring. And so it's, I think of course, there's always an auditing process. For certain areas, there will be labs and they always advocate on that. There was another question, right?
Yeah. Good evening, I'm Lee here. I have two questions to doctor. Number one, can Sky varicella given to adults in views of the complication for chickenpox if those adults that without primary immunity before, then if they would like to get the chickenpox vaccination, can we give?
Oh yes, you can. You see, Sky varicella can be given to adults. It shouldn't be a problem. Like any other varicella vaccine, there's not an issue with it. But one thing for sure, it is not something that would prevent against herpes zoster. See, I mean, herpes zoster is a totally different vaccine that you need to give. But for primary immunity, you can get any of the varicella.
Because looking into the neonatal varicella, in which the pregnant mother, if they got the chickenpox infection during pregnancy, and somehow infected to the babies, if they have the infections during the near delivery times. So it will be recommended to give, but live vaccine definitely during pregnancy cannot, right? So it will be recommended to be earlier, like somebody that planning to get pregnant, then to give the vaccination.
Well, I mean, generally you give it to a non-pregnant woman. I mean, typically you give it to non-pregnant women before they get pregnant. Yeah. So once they are pregnant, it may be a bit difficult for you to give a live-active vaccine because you're worried that they
But
infect.
in the world, will it be if the ladies is planning
to get
planning to get pregnant, but she will not know when she will.
As long as they are non-pregnant,
That is safe to give.
safe to give.
And then second question will be for the 2-dose schedule. For the best coverage will be 3-month interval or at 4 years old.
Well, it depends on the individual practice. I mean, the recommendation is 3 months. If you're using the Varilix or the Varivax, it's 3 months interval from the initial primary dose. Right? But like, for example, in my practice, I mean, I'm just using my because I do a combined MMRV as my primary dosing at 1 year of age. So I tend to give another MMRV later on when they are 4 to 7 years of age. This is my what I practice. Because at the end of the day, if you look into the varicella vaccination, it gives you up to around 92% coverage. So it's a very good vaccine to give. I mean, the conversion, I mean, the protection is pretty much alright with one dose. It's just that with the second dose, it gives you a very higher form of protection. Yeah.
I think the practice changes.
Thank you.
When you talk about chickenpox vaccine, the 2 doses, I will try to complete the second dose before they go off, because most of the time they are more compliant to complete what's in the NIP, which is up to 18 months. And then after that they will go off. You expect them to come at 4 years old? Probably not. So usually I'll do about 2 years, because I would say that we have to watch out for their development, growth and things like that. Or at least the first 3 years they still follow up with us, hopefully. But most of the time, after 2 years they just go off.
True, correct.
And that's the best way to avoid, I mean, you're not getting the second dose until you have. Any other questions?
Dr. Selva, can I add on to the dosing part? So, scribe varicella has more virus and antivirus in the dose compared to Varilex and Varivax. So this is actually advocated at 1 dose. But in Korea, they are giving it 4 to 6 years as a booster because they have seen breakthrough infections at that point. So for Malaysia, where the incidence is low, where the disease burden is low, I think single dose is good enough because it contains a higher amount of virus.
Yep. Thank you, everybody.
Good evening, I'm Satnam. I'd like to ask about pneumococcal vaccine actually. Can we mix the vaccines? Pneumovax, Pneumocil?
Yeah. I mean, well, those are non-conjugated vaccines, Pneumovax and Pneumocil. If you're talking about conjugated ones, Previna, Synflorix, and all this, they are the conjugated group. So, I mean, when it comes to vaccine, it's very difficult. There's never a study to show that what happens if you changes the brand of the vaccine, even though it's the same kind of a group of vaccine. But literally, we tend to feel that it is in a situation where you can keep to one particular vaccine, meaning that now to use pneumococcal Previna, I will keep to Previna until the end of the completing, because then we have a data to show that this is how good it is. But in a situation where we do not have Previna, so to say, then changing it to a Synflorix is something that we wouldn't mind. But again, the data will not be clear whether you get the same kind of protection from the vaccine. This is one. But when it comes to conjugated vaccine, it's different. Pneumocil, Pneumovax are all conjugated vaccine. Their efficacy is limited, so you do not have a long-term kind of vaccination. And therefore, I think these are the vaccines that are given to, I think nowadays it's more towards the elderly group of people, the pneumovaccines.
Sure, thank you.
Thank you, Dr. Azam. Any other questions for Dr. Azam? It's almost now 7:30. Yeah. I think we all will agree. Any other questions, Dr. Azam? No. Okay. Thank you, Dr. Azam. You stay on the podium.